Hello again and welcome back to Viewpoints on the Line. The third issue we're talking about, the headline, BC follows Europe's lead with pay-for-performance hospitals. Well, this article, as we know, we're facing a problem, wow, it's a universal one, I would say, as the population gets older. Emergency rooms are being filled constantly. There are a lot of complaints we hear across the board with waiting times in emergency rooms. And BC has come up with a $16.4 million venture, and it's basically pay for performance. The faster they can process people in emergency rooms, I guess they're aiming at efficiency, they'll be given more money as opposed to, here's your load of cash, do with it as you please. You're going to be paid for your ability as a hospital. Is this a good idea? I mean, according to what they've said in Britain, it's been up and down. They've had their negatives, their positives, but overall they say it's translated into some form of success. Rabbi.
I think that there's nothing perfect.
Do you like this
No
model?
system is perfect, but as a rule, it makes a lot of sense to me. I think you need to give people an incentive. You're saying to the hospital that if you earn it, you'll get more money to do what you do better. I think that makes perfect sense. I think that when you take away the desire for a person to be successful or to demonstrate success, the drive for victory, the drive to be an enterprising person, you end up with a disaster, a system where people just don't perform. And we've seen that. Communism was a disaster because of this.
Yes.
You need to motivate people. Is capitalism a perfect reality? No, it's not.
Well, critics are actually saying, well, you think it is, I know that. But
even you know that it's not. There are imperfections because people are not perfect. But that doesn't matter because you know what? At the end of the day, you're getting the best out of people. In Torah knowledge, there's this concept of something called nama d'chsufa, called bread of shame, where God makes us work for it so we feel that it's meaningful and that it has value.
Do you think it'll lead to carelessness, though? Do you think that exists, where they might say, well,
you think there's no carelessness now?
Well, there is. No, I know, but compounded carelessness, put it that way, because I'm in a hurry, so let me rush this person through as fast as I can. That's my basic concern. In the article, the critics say that it's changing it into a profit system, which I'm not sure, to me, that's the biggest argument here, but I'm concerned about the process involved.
I just want to make a point, and then give the mic over to you. Is there a possibility that they may squeeze people through? Yes, certainly there's such a possibility. Yes. But remember, you can also put checks to see that not only the service is swift, but that it's effective.
Exactly.
And that people are happy.
And that's needed. Yes.
No problem. But you got to do something to motivate people.
Yes.
That's probably the key question there. The money apparently comes in $60 if you get the person out the door within 2 to 4 hours. That's a scary proposition.
Got to have a contingency.
Well, I mean, what they're saying is we want time efficiency. Not that they want higher performance in the form of better care, but rather they want more bodies moving in one door and coming out the other end. And I think the reason for this, the motivation behind this policy, is that we had this decision in 2005 that said if you can't get a person into the hospital soon enough, then the province cannot monopolize health insurance. And so to protect their monopoly, what they're doing is saying, well, we've got to prove in some way that we've put more bodies in one door and have them come out the other door. We don't have to prove that they got good care. That's not required by the court's decision. So as I see it, this is a way to take a situation where probably doctors are already working as many people as they possibly can and saying you have incentive to do less with each person. So we're going to ration how much care each person gets further. That's going to cause a even worsening of the system, not an improvement. More people will come in, but they'll be getting Band-Aids for heart attacks. I have no respect for this plan at all, and I think if you want to motivate people, let them do it the good old-fashioned way. Let them make a profit. And let the system be private. Let people, patients
You're talking
pay.
about total privatization.
No, I'm saying let the private system or the private market compete with the public system, and I don't think anyone will want the public system. People, once they know that they can say no to bad care, that they can take their dollar and go elsewhere, will. And that will make sure that all of those, it'll separate the wheat from the chaff. The poor performers, those who don't give good care, will no longer exist, and so the patient will be in control of the quality of the care.
What happens to the poor, though? What happens to the genuine poor?
Well, that's a monetary issue. That's not a health care issue. In other words, if there's I have a problem as a poor person paying for my food or my health or my education, that's a question of money. It's a question of me getting a job and employed. And for
yes,
those
but
who
I'm
can't
making
work,
minimum wage. I can't afford it. I can't afford to pay for my care. What do I do in a case like that?
You don't enslave your brother. At that point, you have to either make more improve your skills so that you can make more, find a second job. It's
You'll
not...
always find that,
can.
yeah, you'll always find that poor
segment.
segment.
Has a segment that, that can't do better. And we have a moral responsibility to take care of other human beings. You can't say, well, survival of the fittest.
You see, that's the issue I have.
Survival,
You've got to have a contingency for the poor, because I see it as, even if you drive up the wages of the poor some way, you're going to drive up the upper end as well. Everything is relative, so when the lowest bar goes up, the highest bar is going to go up, relatively speaking, as well.
I think what you'll find, though... sorry,
yes,
Christine.
no, go ahead.
I was going to say that what will happen... Right now, we have a situation where you get everything under one plan. You get back care, you get heart care, you get not only the acute care for horrific situations like a heart attack, etc., but you get care for, you know, I cut my finger. And some things that could
People abuse the system, we know that.
And so what will happen also, if you get rid of some of the monopolies that physicians have, let nurses do things, let paramedics do things, and those proposals have been on the table, there will be a multitude of additional workers that will drive prices down, so that if you've got a problem where you've skinned your knee having come off a skateboard and you need 6 stitches, you go to the stitch place. You don't go to the hospital. And the paramedic or the nurse stitches you up, gives you a bill for $40, you pay cash and off you go. But when you have the heart attack, you'll have the insurance plan that cost you less because you didn't have to cover things like split knees and you know, these minor incidents, a sniffle, an ear infection. You didn't bother insuring for those things. And when you don't insure for those small things, the price of insuring for the big things, the big amounts that you need, goes right down.
I have a good friend who lives in Norway, and he told me that there it's virtually communist. I mean, the system is so socialized that it's virtually communist. And he said, you don't get care, period. You just don't, unless you're dying, you're not going to get cared for. He says they don't even give penicillin out.
Right.
I don't know how smart that is. You know, there's a danger in these extremes of taking things to one extreme or another. I don't know if this is the perfect plan. And it's an interesting thought when you tell me that this is actually a way to protect the social system, because I thought that people who are proponents of socialized care would be very angry about this. It sounds like privatization.
Yeah.
You're saying no, this is actually the social activists trying to protect themselves. Okay, I got to admit you're a counterintuitive guy. I wouldn't have, I wouldn't have thought of it that way, but there is value and there is merit to creating a system where people have to accomplish. People can't just be.
Absolutely.
Otherwise, you have a system of decadence. You have a system where people rot, and they don't have to prove that they can do a better job. Maybe it's not just about time efficacy, but that has to be a part of it. To be efficient with your time when you have to be efficient it's a meaningful thing. And you know, when you have a limited amount of time and you have to get the job done, you get it done.
That's right.
When somebody's getting paid to do a job, you're getting paid. Well, how much? Whatever, just do the job, you know?
It's not a lot different
than somebody's getting paid by the hour.
Here.
You have an hour to do this job, but you don't get paid. The job gets done.
I'm going to play devil's advocate for a moment. It's not going to stop here. If this takes off across Canada, what's to stop it from perhaps going into the education system? There's problems. There are definitely problems with public education. What about there? What about accountability there in terms of how the kids perform? I have none. I have no problem with revamping a system, but the problem is always, how do you do it?
Same thing.
How do you do it?
Allow competition. Right now, we force people to pay into a school system that they don't necessarily want to use. You're not forced
So are
to use
you
the
for the
public
religious
I'm
education
for whatever
thing?
kind of education you want for your child. Pay directly to the school that you want your child to attend, and you should not be forced by the government to pay for a school that you don't want your child to attend by paying taxes. In other words, education shouldn't be tax-funded, it should be parent-funded. You pay the school that your child
But you have to have a certain number of schools per block. I mean, you could end up with...
That's why we talked about earlier, I asked you if you were pragmatic. Realistically speaking, there are people who don't have children, so they say, well, I don't pay into the system. I mean, we have a social obligation to create education for our next generation. It's not such a simple thing. A government that wants to be productive for its citizens has to provide education for its citizens. It is immoral and really illegal by the ruling of the United Nations to fund one specific system, like a Catholic school system, and not to fund other religious systems. I'm not saying they should take away the funding from the Catholics. It doesn't bother me in the least bit. I just think I should have the right to have my children sent to a government-funded school that will teach my ideas or the religious credo that I'm interested in. Now my choice is now, yeah, I can send my child to a Catholic school, and that doesn't look very good for a rabbi, or I can send my child to a public school, and that's not that much better.
I agree with this. It's a horrible situation.
But you know what's missing from here, though? The burden needs to be both ways. If you look at this situation in the BC pay for performance, what about those who abuse the system? They go to the emergency room because they have some little fever that just started up, or as you said, some little bruise on their hand, they rush to the emergency room. I mean, the system is being bled by those who just rush for doctor's care and they don't need it. Likewise, the education system. People want better education for their kids. They don't cooperate with the teachers. Their kids a little nightmare in school. raising trouble for everybody, but they don't get involved. So it has to go both ways.
If you'd have to pay a $50 premium every time you went to the emergency room, boy, would things change.
You know, I used to feel that way at one point. I used to feel that way, but you know what? A fellow said, a medical critic, that believed that we need to revamp the whole system, and I agreed with him. He says the one downside in that is you're going to have the poor who perhaps they need to take their child to an emergency room, and they won't go, and that kid could end up dead. And that I used to feel exactly the same way, but when I heard that, but there's got to
could it be a
some
token,
accountability.
A token amount. It's funny. You ever see it? You go shopping, people
Maybe
go
up
running.
to a certain age.
They go running for that quarter. It's an amazing thing. People are going to walk on a snowy day across a parking lot to get their quarter back.
Oh, from the cart.
Yeah.
I see what you're saying.
Yeah, from the cart, yeah.
So for a quarter, you have people who are making hundreds of thousands of dollars that are returning their cart. Is that unbelievable? What does that say about human nature?
Or maybe the user fees for those over 18, maybe.
Maybe it could be a token $10. Something. I really believe that $10.
You know what, for babysitting service, and I'm gonna again be a troublemaker here. There are people who are using the emergency room as a babysitting service. They've got to get to work. Their kid has a fever. There's nobody to look after the kid, so they dump it in the emergency room. I've heard of this.
Really?
And for those people, $10 will be nothing.
Okay.
It's beyond mine too. But the kinds of stuff going on in society,
but I don't think you have to deal with
accountability.
extremes. That's really an extreme.
You know what? I wish I could say it was an extreme. I wish I could, but I've heard of those cases.
Again,
from an emergency care worker that says the stuff that people do, the way they abuse the system, it's disgusting, and it needs to be dealt with.
Again, I go back to my shopping cart metaphor.
Well, maybe it's a start, too.
If people are running across a snowy parking lot for a quarter, hey, obviously a few pennies makes a difference to people.
Hey, it's healthy just stretch and reach down, pick up that penny when it's outside the car door.
Okay, bring your pay slip and based on a percentage. Maybe that's the answer. You know what? We're out of time for Viewpoints.
Thanks for having us.
Thank you. Yes, it did. Thank you both so much for joining me today.
Thank you, Christine.
We're going to go for a break now. When we come back, we'll be talking about using the summer holidays to improve your grades come September. Stay tuned.